We're going to show you a way that you can check to see if the subscapularis, one of the 4 rotator cuff muscles, is irritated, and then how to treat it at home. So the first test that we're going to do is called the belly press test. So Kenzie's going to put her hand right there on her stomach. She's going to press in. Does that reproduce pain? And then I'm going to take it one step further, and I'm going to try to pull her hand out while she pushes in. And if she's unable to hold that, or that recreates her symptoms or increased pain, that test will be positive. Then we're going to show you the lift-off test, also known as the Gerber's test. So she's got her hand behind her back here, and she's going to try to lift her hand off her back. Now, if she can't do that, that test would be positive, or if it reproduces significant pain, it will be positive, especially in the front part of the shoulder. And take it a step farther, I'm going to push in and resist her, and I would always compare these tests to the opposite shoulder just to make sure that there's no asymmetries, that maybe it's normal for her. Now we're going to show you a few treatments that you can do at home. So the first and easiest of these exercises is going to be an isometric contraction using a small ball. You can use a towel. So what Kenzie's trying to do here is rotate and pull in and just hold that. She's going to hold that maybe for 5 to 10 seconds, just starting off with light amount of effort, and then she's going to progress into it, and she's just pulling in. Now, she can move her arm back and forth. She can leave it in that position and just kind of squeeze. We don't want a whole lot of shoulder rotation movement with this, but if you can and you want to go out some and then come back in, then you can hold it in. That's a great isometric contraction. Now we're going to show you how to do this against a wall. If you don't have a ball at home, you can do this against a corner of a wall. Kenzie's doing the same thing. She's got her hand and wrist in here. You can use a towel to put in there if you want to create a little buffer. And she's pulling in, trying to pull her hand or her fist in towards her stomach. And she's going to hold that again for somewhere between 5 to 10 seconds. And then just complete that for 2 to 3 sets, maybe 10 to 15 reps. So taking this a step further, we're going to do what's called band walkout. So this again is going to be an isometric contraction. So she's going to keep her forearm here and her shoulder, everything in neutral. And then she's just going to sidestep towards me while the band is attached over here to the wall. So she's going to just step out, and then she'll hold that, 5 to 10 seconds, and then she's going to walk back. And she would do repetitions of that, somewhere between, 5 to 10 repetitions, maybe 10 to 12 repetitions, just depending on what she could tolerate. Now let's go a step farther with that, and let's show an active, what's called isotonic contraction. And so what she's going to do now is stand right here and elbow by the side. Very important to keep the elbow close to the side for this initially when you're starting. If you have difficulty keeping the elbow by the side, just take you a towel, roll it up, and kind of tuck it in there. You got to hold that towel in. So now she's just going to go against resistance here and come in and out, and then right back out, keeping that elbow tucked in. And then she's going to complete somewhere between 8 to 12 or 10 to 15 repetitions, something really within the range of 8 to 15 repetitions with this for 2 to 3 sets. When I have rotator cuff dysfunction, I always like to add in some scapular stabilization exercises or some kind of contractions between the scaps here, bringing them together. So she just has a piece of PVC pipe here. She's going to push it off her back, squeeze her shoulder blades together, and then come back down, holding that for a few seconds. Now, if this is too painful, because remember, with that Gerber or that lift-off test, she may not be able to bring her hand off her back. So this may be something we have to progress into, but eventually really focusing on squeezing those shoulder blades together when she comes back. This is a progressive way that you can stretch using a piece of PVC pipe. And so Kenzie has her elbow by her side. We're going to start there. And she's going to use her left arm to push her right arm out, holding that stretch 10 to 20 seconds, and then she's going to come back in. She is progressively working to get her elbow all the way up and then pushing this back into more external rotation, which that will apply more of a stretch on the subscapularis muscle. We hope this video helps. If you're having subscapularis dysfunction, make sure you head to my website, ChadGOrthoOT.com. You're going to find information related to orthopedics, sports medicine, rehabilitation, and links to some awesome products. Thanks so much.